BHI is not unique. When we look at different countries, there are almost always an organization that provides a fair and independent assessment of how things are going, so that we can really trust when we have measurements that suggest that there are improvements, or measurement that suggests that the system is performing in an outstanding manner, but also that we pay attention when we find that some areas are not as well performing and might require a focus in terms of quality improvements. Other organizations play such role in other countries such as the UK. Canada's got a few organizations like this, and of course the US as well have fairly well-established organizations reporting on performance. And the way this supports the healthcare system really is through providing information to support different levers that help improvement in the system. Information with regards to performance is good to provide to clinicians, to managers, so that they know about their own performance, about things that they might want to improve, etc. But also, and that's where a transparency agenda is very important as well, it's good to know about other people's performance, other clinicians' performance, and other managers' performance, so that you don't just have an assessment of where you stand, but also an assessment of where other people stand. And you might want to emulate some of the good performance of your colleagues or a neighboring hospital, as well as understand if some specific models of care that have been implemented in certain parts of the system seems to have a good impact, and something that you might want to implement in your own hospital, in your own clinical setting. So providing this information in a transparent and fair way is extremely important to support quality improvements and really generate motivation to change across the entire system. Of course, also sometimes this performance reporting is for accountability purposes. Sometimes there are explicit targets that we ask emergency departments to meet, and ministries, organizations at the Commonwealth level, for example, would establish such targets. BHI has a role to reflect on progress with regards to those specific indicators. Sometimes there are penalties associated with not achieving those targets, or financial incentives to promote achieving those targets. So performance measurement has got a key role, but it is really complex in the way that it influences clinicians, managers, and policymakers in their decisions and their daily activities. And that's why we try to diversify our products so that it really supports quality improvements through all of those channels.